brings us to your weekly capsule of health information, your healthy dose. And we're very privileged to have, once again, as he clips on his audio device, Tim Polly.
Good morning.
Morning, Tim.
Happy Friday.
Oh, I know. I'm glad it's here.
This is National Wear Red Day. You've conformed. I've conformed. Bryce and Greg are trying to with the NBC peacock symbolism there. But this is National Heart Health Month, and this is the way to that, you adhere to those New Year's resolutions, exercise, eat better, lose weight, lose some bad habits.
It is. I mean, usually after the first part of the new year, everyone is out doing the whole New Year's resolution thing. And right about the time it begins to get cold in February, people begin to kind of tail off a little bit. So with Heart Month coming up, what we put together was this, there's a concept that the American Heart Association started called Simple 7. And so we decided to implement Simple 7 within the system.
Okay. So let's talk about the Simple 7.
Sure.
What's number one?
Number one is get active. There are actually a complete 7 steps, all of them geared towards to improve your heart health. Stats show that stroke and cardiovascular disease are the #1 killers, still the #1 cause of deaths in the country. So by just increasing your activity and following these 7 steps, basically will improve your heart health.
You and a number of other people we've talked to on the show, along with a lot of the national talk, if you will, is just move. Get up off the sofa and start 15 minutes a day, increase it to a half hour, 45 minutes. Work towards a goal.
There was an interesting video that was on YouTube about a month or so ago that sort of went kind of crazy. And it was called 23 and a half, meaning you have 23 and a half hours within a day. All you need to do to begin to get active is 30 minutes a day. We all have 30 minutes a day. There is, whether it's 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes at night, there is a 30-day time frame within our day. We're all busy running kids around, but 30 minutes a day is all it takes really is to get a better heart health.
Yeah, simple as that.
And it won't take that long to notice a difference either if you just start applying that 30 minutes a day.
No, it doesn't. I mean, I not to get personal or anything, but when I started at the hospital about 3 years ago, I had a 54-inch waist. And all I did, and hated exercise. I built up to that. And then, you don't want to get started because how do I get started? And all I did was get started. And now I'm down to about a 44-inch waist.
Congratulations.
I thank you, but it's just getting started. That's the key part.
Breaking that barrier.
Well, it is. I mean, there's another stat that said 70% of Americans do not get the physical activity they need. When it doesn't mean you have to go to the gym. All you have to do is step outside your door and walk.
Yeah. Push your chair away from the computer monitor and just get up and walk for a couple of minutes.
That's the easy part.
Yeah. All right, step number 2.
Control cholesterol. It's been proven that when you control cholesterol, you're giving your arteries the best chance to remain clear of blockages. And if there's fewer blockages, then you have fewer problems that could occur for your heart. And primarily, if you've had issues with cholesterol, you should probably constantly check with your physician once or twice a year, or at the very least go to a cholesterol screening.
Okay, and there's a lot of those being held, and we'll get to that here shortly. And number 3.
Now, eat better is one that seems like it's the easiest. And we all know that we should be eating better, but it's so easy. You're tired, you're on the way home, your kids are screaming, I'll just stop at McDonald's, grab some nuggets, and go home. Really, it's eating better is the key to the whole thing.
Yeah, when I did the story on the blizzard of 2011, there was somebody that said, we learned how to cook again because they couldn't get out. And, that's just something as simple as that. Instead of eating out, just fix something at home. It
is, and there's also at the health fair, which I'll tell you about in a few minutes, that's going on at the hospital today, they're doing some fun things where, because one part of eating healthy is portion control, and the other part is just tracking what you eat. So they have items like a hockey puck. So say a Panera bagel shouldn't be the huge one, it should just be the one the size of a hockey puck, or a serving the size of a tennis ball for something else. So you began to look at portion control, and that helps you do better on the eating.
Well, that's going to help you control cholesterol too, and the other things that you talked about.
It is. They are all connected together. If you're active, if you're controlling your cholesterol, if you're eating better, you're eating fruits and vegetables, you're eating fish a couple times a week, cutting back on saturated and trans fats and sugars, then it all begins to kind of add up.
And you begin to manage your blood pressure being the next step.
That would be the next one, and you know, that's one of those things. I hate tossing out stats, but about 90% of Americans have hypertension, and it's just kind of insane. But it's another one of those areas where if you know you have it, if it's in your family kind of thing, if it's generic, if it's genetic, then you know, have it checked frequently.
And a lot of people don't know that they have hypertension.
It is one of,
unfortunately.
it is. It's one of those things that not everybody knows that they have, because people don't monitor their blood pressure unless they go to see a doctor, and people don't go see a doctor unless they're sick.
Mm-hmm.
So, and then they don't want to pay the copay, so they're putting off going to the doctor more and more, and then by the time they do go, it's to an ER visit as opposed to the annual maintenance for health.
Good point.
Well, and hypertension is something too that can be majorly affected or helped by diet.
It is. I mean, eating a healthy diet, you know, reducing sodium and all those sorts of things, they really are all connected to improve your blood pressure.
Okay, and you can reduce your blood pressure by losing weight, which is another step.
It is. I mean, you begin to see kind of a pattern of these. We have probably, when we looked at stats, not we, but a lot of agencies looked at the obesity rate of Illinois and Missouri. They are two of the highest states in the rate of obesity and the rate of everyone being overweight. And it truly is kind of sad, because if we have a large population that's overweight, that's obese, then we have a large healthcare cost. If we have a large healthcare cost, then there's no funds to be allocated for other things. And it truly is kind of it's an epidemic, not only with adults, but there are more children being treated for obesity now than ever before.
Yeah, because of the lifestyle, a lot of that.
Those computer games.
Yeah, exactly right. Something else too, it's number 6, reduce blood sugar.
Mm-hmm. And again, it's one of those things that if you don't know that you have them, then there are risk factors that you should go in and check for. Control those, get regular, you know, start being physically active, and that also helps.
And something else too, if you made a New Year's resolution, stick with it, and that is snuff it out.
That's the big one. That is the one that, even if everyone is doing all the others, that seems to be the one that people have a tough time with. But there are programs for each of these 7 steps throughout the year. We will have multiple programs where you can come into the organization, listen to a healthcare provider, or listen to a dietitian, or participate in a smoking cessation program to help you stop smoking or do any of those other activities.
Okay. And a lot of support going on. You got, like you mentioned, a big health fair going on today.
Well, we do. And one of the things, before I tell you about the health fair, there is if you go to our website, what drives the Simple 7 program is a health assessment. If you go on, take the risk assessment, you will then identify those areas of those 7 that you are at risk for. And then it spits you out a report. You can kind of identify then what the areas are of focus. Our health fair today is kind of exciting because it's from 11 to 1. On our Hannibal Regional Hospital campus. There will be lots of interactive booths. There will be people there on each topic. So whether it's lose weight, stop smoking, control your blood pressure, control your cholesterol, purely interactive element, and kind of hoping people come out and participate in that.
And you get a debut of a big music video too, right?
We do. Hopefully, our marketing group is pretty creative, and they took the concept that the American Heart Association developed for Simple 7. We're implementing the Simple 7 into our organization. Our marketing group then took that concept, made a video out of it, went to every department, and had each department kind of lip syncing to it and providing kind of content. It is an absolute blast. If you go to our website or to our Facebook at Hannibal Regional Medical Group, you'll see the video.
You can kind of be surprised. I've worked in a healthcare environment as well, and you can kind of be surprised that maybe the folks that work there aren't as healthy as you would think they would be working in that environment. So it's good to encourage that everybody take part in these Simple 7.
You would think that we are the primary, our primary care providers, our nurses, our techs, our physicians, that all of them would be the healthiest because they know the effects, they see it on a day-to-day basis. Excuse me, but not necessarily so. We have, we all have bad eating habits. We all have, sitting at the desk all day long, and so we all need to participate in the Simple 7.
It's part of our culture for all of us.
That is true.
Yeah.
All right. I know Hannibal Regional Hospital is going to be offering screenings. There's also going to be wellness get-togethers, vascular screenings. If we want more information, is there one source we can go to?
You can go to the Hannibal Regional Medical Group.org website or Hannibal Regional Hospital website, and you'll find the information.
Okay. Sounds great. February, National Heart Month. So take care of that heart. It's the only one you got.
Exactly.
Yeah.
Don't be a wanker.
Right.
Okay, Tim, thank you very much, sir.
Thanks.
Hope you get to
Thanks,
feeling
Tim.
better very, very soon.
I hope
know
so.
what you're going through, my friend. All right, that's going to do it for this edition of Healthy Dose. And again, if you'd like more information, go to hrhonline.org. And of course, Healthy Dose brought to you by Hannibal Regional Healthcare Systems and Hannibal Regional Medical Group.